Welcome all. Today we will be dealing with the topic classification of partially edentulous arches. We won't be going in detail. We'll be just going with few of the classification. So first you have to know that partially edentulous arches exist in a great variety of forms. According to Skinner, he cited 31,072 combination of missing and present teeth can be done. According to Kummer, in 1920, he stated that there are 65,534 possible combinations of present and missing teeth in dental arch. So why we need a classification? So classification is needed for visualization of combination of edentulous and dentulous arches, communication to technician to uniform the design, that is problem solving design. Example, if tori in maxilla, we have to modify the design. Anteriorly, in case with a highly resolved bridge and a mobile tool, we have to modify the design. So for the design purposes, then standardization of the work principle. So for these reasons, we need classifications. Then, what are the ideal requirements of classification? It should be easy to visualize. It should be easy to differentiate, that is, between tooth support and tissue support to move partial denture. Then it has to be universally acceptable. Then coming on to the classifications. So the first one is Kummer's classification. It is a first professionally recognized classification, and it was put forward by Kummer in 1920. And according to him, 65,534 possible combinations of present and missing tooth are possible. In presenting his proposed system, Kummer stated that for working purposes, all of these cases may be made to fall into four simple classes, which have as their basis the choice of number and position of direct retainer. He basically designed his classification based on the position of their direct retainer. So, according to him, class 1 situation. Class 1 situation is a partially edentulous arch in which two diagonally opposite teeth are chosen as abutment teeth for the attachment of direct retainer. Here, DR abbreviation is for the direct retainer. You can see it from the figure. Then comes class 2. In class 2 situation, a partially edentulous arch in which two diametrically opposite teeth are chosen as abutment teeth for the attachment of direct retainers with an indirect retainer as an auxiliary attachment. So you can see the indirect retainers in the anterior region. And in class 3 situation, it is a partially edentulous arch in which one or more teeth on same side are chosen as the abutment teeth for attachment of the direct retainer with or without indirect retainer. So it is a simple classification. Then class 4, a partially edentulous arch in which three or more teeth are chosen as abutment teeth for attachment of direct retainers. The teeth are displaced in a triangular or quadrilateral relationship without the use of an indirect retainer. That is the class 4 situation in Kummer's classification. So, even though Kummer's classification was given in 1920, there was various limitations in that, and these limitations included complexity of the design or the complexity in understanding the classification. It does not allow easy visualization. No information about relationship of the edentulous spaces to the abutment teeth was given. No differentiation between the tooth and tissue support. So came the Kennedy classification, and the Kennedy classification was put forward by Dr. Edward Kennedy in 1923. It is a worldwide accepted classification, and it is based on the relationship of the saddle to the natural tooth. That is the relationship of the edentulous space to the abutment tooth. So a class 1 situation, it can be considered as a bilateral free and saddle. As you can see, edentulous spaces present bilaterally posterior to the remaining tooth. Then class 2 situation is a unilateral free and saddle. Class 3 situation is unilateral bounded saddle. Class 4 situation is an edentulous area located anterior to the remaining natural teeth crossing the midline. The class 1 tissue supported, class 1 is a tissue supported denture, and it has three basic features for success. That is adequate support, flexible direct retainer, and presence of an indirect retainer. And the class 3 situation, it is actually tooth bone denture. Okay. So when we fabricate for a class 3, it is usually a tooth bone denture. So it will be with a direct retainer to retain the processes. It may contain a direct retainer, but without basic support from the ridge. The class 2 situation, it combines the features of the both. That is, tooth modification has to be done, and tissue support as a class 1, and similarly tooth support as class 3 denture. So there is something called as modification space in Kennedy classification. So what are the modification space? Additional areas of edentulism may occur within dental arch other than that dictated by primary class. And these areas are called as a modification space. And in Kennedy classification, number of modification areas are included in the classification, only the number. So what are the advantages of Kennedy classification? It is relatively simple and can be applicable nearly all semi-edentulous condition. Immediate visualization, easy to distinguish between tooth supported versus tooth and tissue supported. Logical, it has got a logical approach and it forms the basis of other system, basically the applicate Kennedy system and the Swenson system. And the disadvantages, it includes, it gives little information about the teeth present and their positional relationship. No more information than the cast of the partial edentulous condition can be obtained. It does not focus on the biologics, that is, condition of the abutment teeth and span of the edentulous space is not considered. It is based just on the incidence of the clinical situation requiring removal processes. And as as the number of teeth missing can be specified, support cannot be analyzed with this classification. So these are its disadvantages. Now coming on to some rules for the simplicity of this that has to be considered for the simple classification of the Kennedy. So this was put forward by the applicant. So hence the applicant rules. These are 18 number. So the first rule, classification should follow rather than proceed extraction that might alter the original classification. You can see in the figure. Okay. Rule 2, if the third molar is missing and not to be replaced, it is not considered in the classification. Rule 3, if a third molar is present and is to be used as an abutment, it is considered in the classification. Rule 4, if a second molar is missing and is not to be replaced, example, the opposing second molar is also missing and Rule 5, the most posterior edentulous area always determines the classification. That is, the posterior most area determines the classification. And rule 6, edentulous area other than those determining the classification are referred to as modification spaces and are designated by their number and not by their extent. Rule 7, the extent of modification space is not considered, only the number of additional edentulous area is considered. And rule 8, there can be no modification space areas in class 4 arches. Any edentulous area lying posterior to the single bilateral area determines the classification. That is, any space, edentulous space in the posterior region determines the classification. Hence, no modification areas is present in a class 4 arch. That's all for now. Thank you. The rest of the things or the classification will be considered later.